The Kenya National Blood Transfusion Services is facing a crisis that the Medical Services Ministry hasn't successfully tried to resolve for the last 3 weeks. Pictures obtained by KTN show empty shelves at the main National Blood Services Center, with reports that private and public hospitals now have to rely on their own hospital banks. The Director of Medical Services blames the former management for the crisis, saying it was engineered to force the government to approve a particular tender.
It's bad to cause an artificial shortage of blood so that you can fulfill your interest of satisfying a machine which has not been agreed upon. This is the point. And you deny almost half of the country.
The director says the issue was the lack of reagents used to process blood. Without them, the Transfusion Services Body, which has 7 regional banks, cannot test blood to ensure it is safe. Its services have thus been forced to grind to a halt as the dispute rages. Kimani blames people he says want to blackmail the ministry after being involved in corrupt procurement.
If you are in my possession, won't you act? And would you be failing your duty if you hear half of the country is not the shortage of blood, and when you find out is that some people are not getting the, then you find out there's even a machine which has been bought, you do not know, the PS does not know, director does not know.
Sources have told KTN that yesterday a meeting by US-based Center for Disease Control from Atlanta, USA and ministry officials sought to know why there was a crisis, yet 300 million shillings was being disbursed each year. There are claims that the crisis exists because a high-ranking government official at the Ministry of Medical Services is pushing for the control of the funds and change of policies. Dennis Okari, KTN Prime.